Welcome to the Reinventing the White Coat podcast, where we delve into conversations aimed at helping you foster a healthy relationship with your career and yourself. If you're a physician feeling unfulfilled or burned out or want to prevent yourself from going down that path, then this podcast is for you. I'm your host, Jennifer Scher, pediatrician, chief wellness officer, and executive and life coach. Sit back and relax as we explore ways to live your best life and have a career in medicine. All right, welcome to another episode of Reinventing the White Coat. And today I'm really excited to have with me Dr. Kathryn, or Katie, Jobbins. Now, Katie is an internist at Bay State Health, and she's also the co-chair of the Health Systems Wellness Committee. She enjoys both her medical practice and is also committed to supporting her colleagues, both on the individual and system level. Honestly, she's lucky to work for a health system that's so supportive and on board, but really, in my mind, they're more lucky to even have you, Katie. So welcome, and thank you so much for joining me.
Thank you so much for the invitation to be on the podcast today. It's really exciting to be here with you.
So, Katie, I actually got connected to you. I don't remember when, but a while back, I was actually at a retreat on a resilience retreat, tools for work-life balance. And there were quite a few doctors there actually dealing with like transitions and reinventing themselves type of things. And one of your doctors was there. And when she heard what I was doing, she was like, you have got to meet. She was just going on. And she made that lovely connection, which I'm so grateful for. And so here we are.
No, and I love that too. And I think about the power of connection of people. And a lot of times when I've met some of the coolest and most influential people in my life, it's because of those random connections of just kismet, where you're like in the right place, the right time, and really get to connect with people. So I'm so grateful that you got to meet with one of the docs that I work with and got to kind of meet me through that way as well too.
Yeah, well, after we first spoke, for full transparency, I was a little bit overwhelmed. Like you and your organization are miles ahead of where I want to be at my organization. But after sort of digesting that feeling of overwhelm, I was like, okay, I'm going to tap into Katie as a resource, and I'm going to be a little bit of a copycat. So I was hoping that today we could have a little bit of a conversation. I've already implemented some of the things you shared with me, and it's so exciting that we could share some of that with a greater audience, because a lot of these things are doable at healthcare systems, individually and system-wise. But before I ask you specifics, tell me about your practice and what you're doing for you as a doctor.
Yeah, sure, of course. So I have kind of had a really windy path to get to where I am today. In another life and another residency, I was a general surgery resident. Actually, I was. So I did 2 full years of general surgery. And it was that initial curiosity that led me to change residencies. And so I think it was a really great mentor for me that told me that curiosity is the way to help you maintain what you love in your practice, and also to make sure you're on the right path. I went to this amazing, when I changed residencies, I went to an amazing women in medicine presentation at a national meeting. And it was by Dr. Missy McNeil, who used to be at UPMC and now she's at Brown. And it was supposed to be this women in medicine, distinguished lecture speaking talk. And she talked about instead about the life hacks that made her sustain her career in medicine. And I just remember being, a second or third year resident and this talk being like, wow, okay, she's been in her field for 40 years and has done it her own way and really sustained a career that makes sense. And so for me, it really sparked this idea of, what do I want? How do I want it to look like? And how can I make sure it's what I need, but also what I want? And recognizing that women in medicine, we're horrible at boundaries. We say yes to everything. And I make many mistakes around this often, but it's also the idea that I can change my path if I need to. So I remember being in this lecture and she talked about, the 2 firsts and the 3 firsts, how we can combine things we love to get more out of it, how we can have the right people on our bus that actually make our jobs better and easier. And if it's not the right bus, how can we change buses?
Mm-hmm.
And, and I think about that has really led me to fall in love with academic medicine and really be an educator at heart and, saying, no, I'm not going to go do a fellowship. I'm going to be a general internal medicine physician. I want to be an educator. And when I got out of residency, my first job was not in education. And I remember another really great mentor gave me the book, Designing Your Life. And when he gave me that book, it was because I said to him, yeah, my job is fine. That's all I said. I didn't say I'm miserable. I didn't say
Right.
that I hated it. I didn't say anything crazy. But it was this idea of a really great mentor, and having really great mentors in your life can help you design your career. And that was part of what provoked me to change, to go back to medical education and really lean into that. So, for my practice, I did primary care for 10 years and I love primary care. And have always worked in, rural or community health-based practices, always said I wanted to be an educator. So even when I wasn't in the education specific clinic, I had med students and residents with me because it's where I truly get the most joy
Mm-hmm.
and I feel the most fulfilled at what I do. And prior to the pandemic, I wasn't doing hospital medicine at that moment because I had young kids and I didn't want to spread myself too thin. And I was an APD that was brand new. I was trying to create initiatives within the residency to improve resident self-reflection curriculums, wellness curriculums, trying to really think about how we could make our residency more robust and actually decrease the burnout we were seeing. And when the pandemic hit, I was the closest to graduation in our programming and in terms of faculty. And they said, we have to redeploy you. And I said, okay, I got it. And so that's how I got back involved with academic hospital medicine. And it was fascinating because now, as of the fall, I precept in our clinic, but I don't have a panel of primary care anymore, which if you would have told me 5 years ago, you're not going to be a primary care physician anymore, I'd be like, what?
Yeah.
That for me is, I have always loved that continuity, the relationship building, the hard patient. But I love academic hospital medicine just as much in a different way.
Mm-hmm.
And so for me, my practice is I do mostly academic hospital medicine. And I'm really lucky I get to be an APD for our residency, which is one of my favorite jobs I ever get to do. I'm an assistant clerkship director for the medicine clerkship. So I work with UME and GME. And I'm really lucky I get to work with faculty. I do a lot of physician coaching, and I do a faculty development series that's called Mentors Matters. And so I get to work with really early career physicians and some mid-career around how mentorship means something. And part of the reason I wanted to be involved with that is because of how meaningful my relationships with my mentors were for creating and curating my career. And I wanted to empower other physicians to have that, and APPs as well too. And then the newest part of my job is the wellness. So I get to be really involved with shaping initiatives, wellness efforts, getting rid of those pebbles in people's shoes with my colleague, Zach Testo, who's an EM physician. And so the two of us have really been trying to spearhead meaningful change at the institution by leading the wellness council, but also really creating a space where there is input directly coming from the frontline people.
Yeah.
That we can make positive changes, we can make implementations that make sense. And also, I love the fact that our senior leaders are truly listening to us because they recognize we represent the voice of the people that work here.
Yeah. Katie, so much of what you said I love, but I really love that you had a mentor that picked up on the tone of fine, so to speak, right? I just feel like, don't we deserve more than just fine? Don't we deserve so much more than that? There's mental illness, and then there's baseline. And I feel like we deserve to live up way above that fine line, so to speak.
100%. And I think for me, it was his face when I said it that was really like this mirror of, oh, I don't want to strive for fine. I want to strive for joy.
Yeah.
And even just saying I want to be happy at work isn't enough. I want people who work in the field of medicine to find joy in what we do, who actually don't want to have that, okay, I got to get out of the car moment. It's fine. I just got to get out of the car. I don't want that for anybody. And his insight into knowing that that was not okay changed the whole trajectory of my life.
Yeah.
And I think about the people who have taken a chance on me when I wasn't the right person or I wasn't the typical person. Those are the moments that have impacted me the most. And I think if we can create people's space to be available to see those subtleties, that's how we change medicine, really. He happened to see my face and the tone of my voice change. Another mentor realized that I was going on a great path, but that I was really stressed out about this path. And I think those are the moments that truly shape the face of medicine. And I'm so grateful that I've been able to be lucky to be on the receiving end of those moments.
Yeah, but you have to be open to it, right? Because your mentors can't possibly know what's deep inside of you and what actually does light you up.
Yeah.
And you have to be open and willing to kind of tap into that. So, how did you know surgery wasn't for you? What were you going through?
Well, and I think for me, what started out was I had a family member who was my mother had chronic illnesses. And so I was driving back and forth between Ohio and Massachusetts. And I felt this tug when I watched the experiences my mother had about really good clinicians that leaned me into this idea. Yeah, I have great hands and I love to operate, but I love the relationship building I'm seeing with my mother's physicians. I want that.
Yeah.
And I recognize I started to be the person who was saying, oh, yeah, I'll go to the ICU. I'll round to the ICU. Or, oh, sure, I'll go to the clinic and do the follow ups for those post ops we did. And I loved the idea that I could create a relationship with people that was lasting and I could impact their health in a way that was so different. And I love all my surgical colleagues and all my friends who I was in residency with. And it was an amazing, nurturing environment. But I recognized that the traditional general surgeon who had a relationship with people for years and years and years was not how the practice was going forward anymore. It wasn't feasible. I was
Well,
thinking
who
about
wants to
small
have a
town
surgeon
doctors.
all the time, right? I mean,
Right. I hope not, and so I recognized that I wanted to have more of a lasting impact. And I also can bring that to when I'm rounding in the hospital.
mhm.
And that's for me, my current boss, who's one of the directors of academic hospital medicine, when I was a trainee, had us find out one personal thing about each of our patients. And so when I transferred, and that was part of my curriculum as a resident, I was like, this is the right place for me. And it's amazing when I think about the things I've learned about people and that connection, that human connection is part of what I do
Mhm.
in every aspect of what I do now.
Yeah.
Some of the educational curriculums I've developed, some of the interventions we've done in terms of our residency changes, that all is part of it. So I think for me, when I felt that tug in a different direction, I listened to it instead of ignoring it.
Yeah.
And I have so many colleagues that have had that, but didn't know what to do with it.
Yes.
And my program director, who is in Ohio, was wonderful. And he said, if you feel that way, you have to listen to it.
hmm And there are so many people who feel the the pull towards a specialty that you see a problem and you fix it and it's not that one is right or wrong, it's just that whichever one is right for you. Yeah.
Yeah.
So
And I
Kate,
think that's in my role working. Oh, sorry,
no,
go
no,
ahead.
no, finish. Go ahead.
I was going to say, and I think when I now work with medical students who I see that same, disconnect or discordance that's starting to kind of rub them around, like, well, what do? I love this, but I also love this. I really encourage them to lean into that discomfort and be curious about it because it really may lead them into a place of deeper discovery of what they love.
Yeah. Yeah. So let me ask you, what are you seeing now in your health system and in terms of, the wellness and the stress?
Well, I think what we're seeing, not only here at Bay State, but across the country, is this post COVID, well, what do we do now? The face of healthcare changed. People are sicker than they've ever been, and recognizing that we need to change with the changing times. I'm really grateful that our senior leaders recognize that this is a valuable resource is to have people navigating that disconnect. And that what I'm seeing now that Zach and I have been in our role for a little over 6 months is that people feel seen and heard, that they feel like they have someone who's advocating for them, who are also frontline doctors, and that we understand what's going on with physicians and APPs. I think burnout is a reality. I mean, if we look at the data nationally, above 60% of physicians and APPs are feeling burnt out. That means something. And I don't want to say that burnout is inevitable for everyone, but I think on some level, all of us will feel some level of burnout at some point in our life. It may not be so severe you leave the field of medicine, but that it remains a point that we have to process and talk about and being committed to change. And I think about the disparities in healthcare with the social determinants of health barriers we're seeing with our patients across the countries has been exacerbated by the pandemic. And that, there's this pressing concern about improving our outcomes, and, finances of healthcare is totally different than it was 5-10 years ago. But I think the thing that I'm most excited about, even despite all these challenges, is that the hope is there, that I'm seeing that come back, that there's strong commitment across our staff, be it everyone from the person who greets you when you walk into the door to the person who checks you out, to provide high quality care, that people are invested in improving the healthcare system. There's innovations that I never, ever expected to be part of our discussion. I mean, the thought that we're going to start using AI more in medical decisions and also to improve maybe our inbox management is amazing to me. And that collaborations are coming across not only divisions, people are really trying to break down those silos again, but we're seeing it across institutions, across states. People are really trying to reconnect. And whenever I've gone to a national meeting, people are so excited to see each other in person and really get to know what's going on where people are. It really gives me hope that we can move forward in a way that will sustain and make medicine even better than it was, in the glory days, I guess you could even say.
Katie, how are you connecting with people so that they do feel heard? I mean, because that really is critical to the, first step, I think, to this whole process.
Yeah, so I think one of the first things that we did here at Bay State was say we need to have an organizational structure chart. I need to know who the people are, recognizing that if we don't know people, then we can't go talk to them. And that was one of the best things that our senior leaders gave us, was they gave us connections, introduced us to people. They put us in front of all the chairs. They put us connected to division chiefs. And not just those physician leaders, but also the administrative leader side too. So that way people understood that we existed, what our new job role was, and that also we were a conduit to the president, the CEO, and the board. And that what they were saying in our Press Ganey surveys or any other internal surveys were then being filtered through us with the lens of we're clinicians, we are frontline physicians, we are educators, we are researchers, we are your colleagues. So we were able to understand a little bit deeper. And also there was a little bit of how do we create the psychological safety? Truly emphasizing that the surveys are anonymous, truly emphasizing we want to foster a supportive environment, and also enhancing collaboration, introducing other people who are doing great things across departments. If one dyad of a physician leader and an administrative leader was doing something amazing and another department was struggling with that same problem, connecting them. Also recognizing we weren't going to get it right every time and saying that, hey, we want to do something. Is this an area that you think matters? And I think about, we do this often with community engagement, but we didn't do it internally for a process improvement and continuous improvement. I think about the one things that we did discover that mattered were some of the things I was most surprised by. And when we brought that forward to our institutional leaders, they're like, okay, how can we work on it? So for instance, everyone has those mandated annual modules you need to do based off of regulatory bodies that require us to do them. And we recognize that we could make those better. How do we meet the checkbox of meeting the regulatory requirements that we have to do these modules? But how can we actually make them so they're not not only a pebble, but like a boulder in your shoe? And how we could streamline that process. Who needs to be involved with the task force who can actually make meaningful changes? Who should own this? And what voices do we want represented on that? I think that's one of the best parts, is that we've invested in not only technology and community, but we've really thinking about how we can do this through collaboration and continuous improvement. So we did this. Is it working?
Mm-hmm.
If it's not working, why? And then really the idea of how it should align with the strategic, mission of the health system. Is this improving patient care? Is this also improving our access? Is this improving the way we retain great physicians we train? And that we want, if we're training great physicians, why aren't we keeping them here?
Mm-hmm.
So not only did we do exit interviews when people left, we're trying to do stay interviews when people are staying.
Yeah.
So we can figure out what that special sauce is that exists and how we can transmit it across departments and divisions as well too.
Is Bay State one location? Is it one large health center?
So we have one main hospital, and then we have a number of different satellite facilities as well too that are smaller hospitals. And then we have a number of primary care offices as well too. And so within that, we have Bay State Medical Center, which is in Springfield,
Mm-hmm.
Wing, which is in Palmer, Franklin, which is up north, almost in Vermont, and then we
Mm-hmm.
have Noble, which is a little bit west as well too. So we have those other ones, and then we're also affiliated with UMass Chan, and we're the West Campus of the Perch program for the medical school as well too. So we have 25 medical students per year that train here and are working with us here at the health system as well too.
So do you find more challenges with the mothership as opposed to the satellites, or?
I think the system has issues that affect everybody. Different sites have maybe a smaller, or I shouldn't say smaller, have subtle shifts in terms of what their priorities are or what their needs are. But I think systemically, what we're seeing is very similar to what we're seeing nationally.
Mm-hmm.
What we see here for the barriers, access to care, autonomy of scheduling, autonomy of saying your voice is heard by your senior leader, very much in line across the country is what we're seeing here as well too.
Okay, so Katie, one of the things that when we first spoke that I got from you was the AMA program that you told me about, and all sorts of free resources that I thought maybe you could offer to people.
Of course.
Yeah, tell me a little bit
Yeah.
about
So
that.
we discovered the AMA Joy in Medicine program, which was really enlightening for us around evidence-based approach. So when Zach and I took the position, we said we really wanted to be data-driven and use as much evidence that we could to support the initiatives we were doing. And the AMA Joy in Medicine program is really innovative in the sense that they have partnered with numerous institutions across the country to try to make not only a recognition system of what you're doing when you're doing it well, but also resources that are available to help you biopsy your own institution around areas you could improve further, other resources that are available across the country, and then also analysis of these biopsies. What are your areas that you're doing well? What are some areas you want to continue to grow? And maybe some approaches you could take with this as well too. The great thing I think about the AMA's program is that it also looks at your EHR and how you could improve efficiency of practice.
Mm-hmm.
It looks at culture change within your institution, creating collegiality. And also, on top of that, there's not only a faculty one, there's one for your residents and fellows as well too.
Yeah.
So they have a survey that's approaching it from all lenses, and they work with you to tailor it to your needs, which is really amazing. I think for me, when I found out about this, I was like, okay, where's the click and pay button?
Exactly.
And I kept thinking it was like those apps that you sign up. It's free, but it's really not free. But it is. It's really free, and they offer it to you They meet with you, they talk about it, they have educational materials, they have, webinars you can go to learn about what are other things that are going on. And the amount of, and I'm on the, I should, as my disclaimer, I am an AMA, I'm one of the American College of Physicians delegates for the recent AMA meeting. And the number of wellness resources that they have created and tools and program that are really focusing on the systemic problems of burnout and promoting physician wellness is so amazing that I didn't realize the amount of networking opportunities this platform would create for us to connect to other institutions with other peers, all of us sharing experiences, and also just finding a place that supports what we're doing, and that's, I think if we create more and more of these spaces where people can connect, the face of healthcare will continue to evolve in a good way.
Yeah. And
which matters.
am not on I have no disclaimers related to this. And I'll say that, we've only had we're in the middle of designing our survey and sort of getting
Yeah.
started and doing this organizational biopsy. And I have buy-in of my top people largely because it's free. I mean, everybody is committed to this in concept, but at the end of the day, if you don't have the money, a lot of the things that you are doing cost a lot of money. But this one, so if you're listening and you want to do something, this is something that you can bring, and it can have pretty significant impact.
And I think also the way that they've created this recognition system, when you start this process, if you implement these initiatives and you meet these metrics, you can qualify for their bronze, silver, or gold recognition, which as a health system, people who you are trying to recruit or who are trying to find out about your, what you offer, it's a way to really disseminate that you're committed to this in a way that's meaningful, I think, as well, too.
Yeah. So before we wind down, I want to ask you, Katie, so all of that talks about the system level stuff, but you've also brought coaching into your program, which I think is also so terrific. And I'd love if you could speak for a minute about how you've done that.
I think for me, coaching really became an integral part of what I was doing for myself. I had a physician coach, thankfully, got it right before the pandemic started, and she has been amazing and really changed how I viewed what I can do and what I can't do, and what was in my control and was out of my control. And I started talking about this with people at my institution, and we had an internal coaching program that was not very well known, and that people mostly viewed it as, oh, I'm in trouble, I have to go get a coach.
Right.
That was the 10 years ago, oh, you got a coach, you did this thing and this happened. And it's really different now. And I remember I was getting my coaching certification and I needed someone I'm like, I'll coach you for free. And it was a colleague of mine, and I coached them, did the whole 12-week program, coached them. And I remember it came up on our wellness council around, should we partner with an outside coaching firm to get people access to coaches in an easier way? And I remember coming to the pitch that this person was going to do, and I just started asking lots of questions. And everyone after the person came off the call was like, how do you know all of this? And I was like, well, I have a coach and I am a coach, and I just didn't feel like it was the right fit for us to use this program. And they're like, well, why? And I started rambling off all the things. And it was an open forum, and the person who I happened to coach for my free coaching to go through my training was on the call too. And they spoke about how much they also loved coaching. Again, unprompted, not like I was like, please talk about coaching and how great it is. And the best part about this was there was a ton of senior leaders on this call. And they said how it essentially changed their trajectory of their career, talked about how they were planning to leave or maybe can change careers altogether, like totally change careers. And it got trickled up within the institution. And then I became more involved with our coaching internal program. And it now, I think about it how currently I coach 7 people. We also have an external coaching program, which we partnered with a different coaching program, which was amazing. And we now are working on how to try to blow this up even further and potentially offer for other people to get certified as coaches, because we recognize how much this adds value,
Yeah.
decreasing burnout. And if you look at the literature, it's extensive and it's really becoming extremely robust around how and what professional physician coaching can do for you.
Mm-hmm.
Meaning that it aligns with your values, it aligns with the institution, it allows you personal guidance around your professional identity and also self-actualization, what you can control and what's out of your control. And I think it's really created a space for people, both, I would say, any level of your career, to help them develop skills and name the goals that they want to do,
Mm-hmm.
navigate challenges, and really it's come to this space where we're trying to create a culture across the whole institution that really emphasizes we're actively listening. We want to have empathy be part of what you do on a day-to-day basis. I don't want you to feel nothing. And if you do feel things, how do you process it? Give yourself actionable feedback, and then create a supportive environment that allows for people to grow and build resilience, and not say it's only your responsibility, that we are partnering with you on this as well too. And I think the empowering aspect of coaching, we can see it in the literature, but we can also see it when we're studying it here at Bay State now. Our burnout numbers in these people who've gone through coaching is dramatically different.
Mm-hmm.
And that allows for people to find space, to find joy, but also to stay in a space that they want to be in and not leave because it's the only option they view as the alternative.
Yeah.
And I think it really aligns with our organization's mission, because it allows for people to provide really great care for our patients who need them the most.
That's great. What I love about also coaching is it's you figure out what's in your control, what's out of your control, but you also grow this what's in your sphere of influence, which
Yes.
really becomes this like huge untapped thing that a good coach can help you, figure out and mold.
Yeah.
Um,
I often
so
joke around. I'm like, I'm the bowl. I'm just there to kind of like help. And if sometimes you put wheels on the bowl, like a stage coach, like I can help you like get there. I'm just like the vehicle.
yeah, yes. So Katie, you make your place, you make Bay State sound amazing. I imagine your guys are always looking to recruit. So if people want to work for your work for your healthcare organization, I will put, a link to it on the show notes, but I imagine it's just
Yeah, absolutely.
what's the website?
Yeah, so it's www.baystatehealth.org, and then I can give you the one for faculty to apply for positions that we have open. I really think the great thing that I have found about being here at Bay State is that not only are we working towards improving physician and APP well-being, but nursing leadership and organizational leadership is really committed to all aspects of this. And I think about some of the new pillars that we have as our value structure really embodies this as well too, and the website really reflects that as well. So I'm excited that we had this opportunity to kind of really talk about what we're doing here, and it makes me really proud of the leadership and all the people who are frontline workers here, because it really does make a difference.
Yeah, I don't know about you, Katie, but whenever I talk about what I'm doing, it really solidifies, it makes it sound so good and so um you feel so proud, but because when you're in it on a day to day, I'm willing to bet you're feeling overwhelmed and pulling your hair. And it's not always this beautiful thing, but
No, absolutely. And I just want to highlight that I am not a Pollyanna. Like I totally am very much like in the weeds half of the time. And I juggle a lot of, I wouldn't even say like tennis balls. They're like the size of like volleyballs. Like
yeah.
they're big, big balls of problems. But I feel grateful that I've been really given amazing leaders. And so, Dr. Arnstein's the president of our hospital, and he truly believed in Zach and my proposal about this matters and this is why it matters. And I think if you're able to use your own data to show your institution why this matters, and then they actually make this something that's actionable, it truly makes those who work with you want to be there. Um, But I think really, you know, there is not always rainbows. There are days when we have very dark, cloudy days. That's everywhere though.
Right.
And, and I think really recognizing if we can make the space where we are in a little bit easier for people to thrive and not flounder, then we've done something right that day.
That's right. It's never going to make the work not intense. The work that you do is intense. That
Yeah.
just is what it is.
Right. And being in healthcare will always have a level of intensity that is different from any other field.
Mm-hmm.
And I think, Tate Schoenfeld said this really, really well. What we do in medicine, if you compared the level of stress and burnout and negative self-talk that we have compared to other professionals or PhDs or any other high level of executive, our level is like 3 times, if not 4 times, than what you would see in other professions. And that's really scary to think about, the amount of times people think that they're imposters or they have negative self-talk. And it is something I think we need to start addressing more actively, and that can help us really kind of figure out our solutions to move forward.
Yes. Thank you so much, Katie. Do you have any last words of wisdom for our listeners before we sign off?
I think for me, just recognizing you have to also take care of yourself. If you're going to do this work, it's really easy to allow for yourself to get caught in to that space of, well, I can fix everything. I couldn't do this without my team. I have an amazing team of people who not only professionally, but personally help support me. So I really have to lean into all of those people. And that if we're not advocating for ourselves, we can't advocate for others. So just remember that's part of it too.
Yes. A beautiful place to end. Katie, thank you again so much for joining me today for this really great topic.
Thanks so much for having me. It was wonderful to talk to you today.
All right. And if anybody wants to learn more about the AMA program or speak to Katie, you can reach out to me or check on the show notes, and I will put all of that in there. Thank you so much to everybody for spending your precious time with us. Hope to see you again on the next episode of Reinventing the White Coat. For this episode of Reinventing the White Coat, if you enjoyed this conversation, subscribe now so you don't miss an episode. If you're interested in coaching or in being a guest on the podcast, you can reach out to me online at sharecoaching.com. Thanks for listening, and don't be afraid to live your best life.